Hi, welcome to Case of the Day. Today is the 62nd case, and the title is The Power of Identifying Ham. This 34-year-old known to have asthma presented with the CT scan, and I saw it today. We scanned the patient yesterday, and you can see here bronchiectasis, both tubular and cystic, in the anterior segment of the right upper lobe. But in the left upper lobe, we have branching white opacities, and clearly this is also, there's bronchiectasis here. This is bronchiectasis with mucus plugging or mucoid impaction. What is the cause? And we know from Rajadhar's paper that this is the cause of bronchiectasis by percentage in our country. But typically, we would be looking at PCD, ABPA, TB sequelae, Munier Kuhn, and cystic fibrosis. And clearly, this is not PCD, and I discussed it as case 15. And you'll see the link on top if you'd like to go through the video. But if you look at the soft tissue images, and that's very important whenever we have mucus plugging, we can see these hyperdense foci within the areas of mucus plugging. And if you use MIPS, and here I've used 13, but anything above 5, between 5 and 15 should be fine. You can see that most of it is hyperdense. So these are high attenuating mucus plugs or HAMs. And if you look at the Isham paper from 24, which revised the ABPA criteria, CT with mucus plugging and high attenuation mucus is an important part of the diagnostic criteria for ABPA. And that paper then also talks about the various radiological types of ABPA, of which ABPA ham is the one that is diagnostic and pathognomonic. And then I did a snippet, which was snippet 23, I think about a couple months ago on this, and discussed this entire thing. So you can check that out if you want. Now, this patient was known to have ABPA, first diagnosed in March 17 by a very smart radiologist in a tier 2 or tier 3 city. And then the patient was treated successfully. In November 20, you can see that the mucus plugging has completely disappeared. You can see that the bronchiectasis is stable in the left upper lobe, which was also the same in August 22. But now the entire thing has recurred and the patient has developed active disease. So, to summarize, ABPA is a common cause of bronchiectasis in India associated with asthma. It is important as radiologists to look at the soft tissue windows of all patients with bronchiectasis and mucus plugging or mucoid impaction to identify HAMs. Also, if you know that the patient is a known case of ABPA, you should be looking for HAMs as well. Sometimes they're very subtle. And HAM in the setting of bronchiectasis is diagnostic of ABPA. That's my WhatsApp channel. Thank you for viewing this.